Dr. Bill Adams here, and this is No Spin Live, and we've got two incredible international experts in plastic surgery, Dr. Chet Mays from Louisville, Kentucky, and Dr. Rick Zenowitz from Providence, Rhode Island. Rick, hadn't seen you in a while. That's a sweet beard there, man. That's like, it's like ZZ Top. All right, well, listen, we got a great show. We're going to be talking about the Florida lawmakers have made sweeping reforms about deadly cosmetic surgery facilities. Rick, I'm going to let you lead it off, but what do you think? This is about Florida lawmakers. You know, there's been a lot of regulation going on, particularly in Florida, but I think in a lot of the United States on safety, you know, certification of surgeons, and also the certification of surgical facilities where procedures are done, and a lot of this stems from patient deaths. So what do you think about this?
So it's like Miami Vice, Miami Slice, Miami Not So Nice. We're hearing about Miami. It's ad nauseum up here. Every time I turn around, it's about, you know, this Dr. Miami or something else that's happening, you know, behind the scenes, the laws, the restrictions, and the bad outcomes. So I have to say that looking at some of the articles that have been out there today, they clarify that most of these bad outcomes are coming from surgeons that are not qualified, and the board has not been doing due diligence on background checks for these people. They say that they don't have enough money to fund through the federal government, and they're blaming it on that. But seriously, they're just not checking out the credentials of these people that are really entrusting patients' lives into their hands.
Yeah, and then there was just another patient death, you know, in Florida. It was just reported another, I think it was a Brazilian butt lift death, and you know, some of that's interrelated because oftentimes if physicians aren't certified, you know, the facility may not be certified. And Chet, like, you know, that's another thing. Patients can be confused, but for example, people that are members of, say, the Aesthetic Society, or ASPS for that matter, one of the things that emblem means is that you've been vetted, you've had proper board certification in plastic surgery, but also the facilities that you operate in are certified. So that's important for patient safety, don't you think?
Right. I mean, patient safety is at the forefront, and, you know, plastic surgery, as board certified plastic surgeons, we have certain standards that we practice to, but you have these little chop shops that, you know, want to make an extra buck, and they pop up all over the place. It's not just a Florida problem. It's a sort of nationwide problem of surgeons coming in saying they're, in quotations, cosmetic surgeons. And when you read the fine print, you realize that there's a lot of gray matter in the middle, and we're trying to educate patients and families. And, you know, we're in Louisville, Kentucky, and we hear about destination plastic surgery all the time. People, oh, my friend went down and, you know, to this boutique. I was like, oh, where was that at? They're like, oh, you know, Puerto Rico. And I was like, oh, who was the surgeon? Oh, they don't know. They were just trying to save an extra, you know, $2,000. And they come back to our office with a wound infection, and there's no follow-up. So we see it sort of from all over. But I'm just glad that it's sort of in the news and people are talking about it in the media about qualifications and qualifications of your surgery center and your plastic surgeons. It just gets the dialogue going, but people just think plastic surgeons or cosmetic surgeons, and they blend us all together. So it comes down to education of the patients and their families.
So Chet and Bill, I was looking at some of the fine print on that article, and they were talking about what the person had paid for this BBL, and the dollar amount was $3,600. And if you're having to do that kind of surgery for that kind of money, I mean, we're talking about that's all in. Those are Dominican Republic numbers. So, you know, they're feeling hard pressed to compete with the offshore surgery centers. Right. And if you have to work on that kind of a fee scale, you can see what they're doing. They're basically just not taking their time. They're doing careless surgery, and they're taking risks. And it's something that is inevitably going to have a problem down the road. And that's what's actually, you know, bringing a bad name to a lot of the surgery that we have to then deal with as a specialty.
And I think probably that another component of this is just that it's kind of the era that we're in social media. You know, I always talk about social media. I can't get my kids off their phone. I can't, their phones, they're in the phone like all the time. But, you know, the other problem I think with it, you know, it's not all bad, but I personally think it's probably net negative because people see all this marketing and things that is easy to do. And so they see these centers and sometimes superficially they look, you know, good. You know, they sound like they're great, but sometimes what you see is not what you get.
Oh, right. I mean, you can credential yourself on social media to be the world's best plastic surgeon, and you can have the flashiest page. You can have something that people want to scroll through and they like and love. And you, once again, you read that fine print, like, this person is not even a surgeon. They didn't do a surgical residency. They did, you know, 1 year of extra training in something cosmetology, and now they can call themselves a surgeon. And it's just scary.